Arizona, it's Wellness Wednesday, and respiratory season, it is surging in our state. Joining us this morning is Dr. Reina Patel. We're going to the experts. She's a pediatrician at Phoenix Children's to break down what families really need to know and how to keep kids healthy. Because, as I just told you, Dr. Patel here, my son is down with something. Emma's kids are getting down with something. It is really starting to ramp up.
Yep. Yeah, it sure is. You know, this is the season, right? After the fall and you've gone through the holidays, everyone's coming back together. The weather is cooler outside. People are gathering indoors, and it's a perfect opportunity for viruses to spread to each other, for kids to share, you know, their germs with each other in daycare and in school.
And then share with mom and dad. And
Of course.
takes the whole house down, right? My goodness.
Absolutely.
So what specific illnesses are really of concern right now?
You know, in the community right now, and nationally, I would say RSV, which is respiratory syncytial virus, influenza, and COVID-19. Those are probably the three to think about at the moment, yes.
Gosh, it's a bad trifecta for sure.
Yes.
I'm taking a lot of people down. I'm sure you guys have seen probably more patients because at Phoenix Children's, I mean, this goes really across the state and across the nation too, but kids seem to be more susceptible to this. I mean, and does it hit them harder than it does us?
Yeah, kids are just different, you know, especially the younger ones, right? They haven't had a chance to build their immune system. So they're still being exposed to some of these viruses, number one. And number two, depending on the age and the virus itself, such as RSV, oftentimes it hits the babies or the younger ones a lot harder. And so I think that, that just makes a difference. And kids are together all the time.
Right.
And so they spread it amongst each other. And so, you know, prevention is the best thing you can try to do.
Oh yeah, I mean, if you can, right? We were just talking about my 9-month-old son. He just wants to put his mouth on everything. And I just see it before I can wipe it down and it's already done. And I'm like, okay, well, let's see how many days until this will show up. So, you know, he is dealing with stuff. A lot of, you know, kids in the newsroom also just talking about it. Parents were like, oh, what can we do? Because it's hard to get, you know, the kids to wash their hands and be disciplined about doing that. Are there any other tips, even though I know that's a great one?
Yes, absolutely. So number one, as a pediatrician, I'll recommend getting your vaccines. Okay. And so anything you could get vaccinated against, you know, talk to your child's pediatrician or their doctor. That's a great prevention strategy. And of course, you already hit the nail on the head, which is washing your hands when you can. You know, and just, I think if you teach the kids to make it fun, and one of my little tips is, you know, sing the happy birthday song twice. And if you do that, you'll wash your hands for 20 seconds, and that's what's recommended. So you really get those germs away. So that's a good thing. You know, other things as parents, I think, you know, if your child is sick or you're sick, trying to keep them home during that time period so that we prevent the spread, you know, and protect vulnerable children as well. Those are all great things to do.
I mean, the most important, right? Prevention is key because you don't want to have to treat it. You'd rather prevent it.
Yes.
I know I hear that from so many doctors as well. So, you know, you talked about COVID, flu, RSV. When we talk about the symptoms and run them down, sometimes they can seem very similar. Is there a good way for us to be able to tell them apart?
The short answer is no.
Okay.
Testing is really the one way to differentiate them specifically.
Okay.
But when you think about the symptoms, you know, usually it's going to be fever, it's going to be cough, you know, nasal congestion, runny nose, maybe sore throat. Maybe your child doesn't want to drink as well. So for the most part, most of these viruses, you're going to give them supportive care. Okay. I think if you have concerns or you're not sure or your child is just not acting like themselves, take them to their doctor, and then you can have a shared decision-making, you know, plan of should we get them tested, and if so, what should we test them for?
Yeah, I mean, cold, that's going around right now too, and you really don't know if it could be something as simple as that or something a little bit more serious. So you did talk about the vaccines. We're really getting in the height of, you know, respiratory illness season. And so is it too late now to get it? Should we just ride it out until next year, or is it like any time is a good time?
Any time is a good time. It is absolutely not too late to get your vaccines right now, especially with the flu circulating. If you haven't gotten your flu vaccines or your child hasn't gotten protected, it's a great prevention strategy.
Can you do multiple of these vaccines at the same time?
You can, yes. Okay. You know, we're all busy people, right? And you're busy at work. So if you're going to take your child in or you're going to go in, go ahead and combine the vaccines together so you kind of get a protection, a blanket protection for everything you possibly can.
Yeah, I mean, so many of these tips, you know, are for the kids, but for the adults, it's just good for everyone to practice the hand washing, staying home if you're sick, because you don't want to take down the whole office either. My goodness. Is there any big message that you want parents to know as we continue to kind of navigate through the peak respiratory season?
Well, my big message is going to sound like probably what all of our moms have told us our whole lives.
Okay.
It's going to be, get good sleep at night,
Yeah.
drink plenty of water, stay hydrated, eat your balanced, nutritious diet, and get plenty of exercise. What I will add to the mom advice will be get your vaccines so you can, help prevent, yourself getting sick. Of course, stay home when you can, and then wash your hands.
Okay, all things we can do to prevent
Yes.
or try and minimize how bad it's really going to be. Dr. Raina
Yes.
Patel from Phoenix Children's, thank you so much for being here.
Thank you for having me.
We really appreciate it.